So I am Cyril Cappai. I'm the country rep and head of mission of MSF in Jordan. Actually, and my main role is to manage, I will say, all the operation of MSF in the country. It's a majority hospital. We have a regional specialty hospital in terms of orthopaedic, maxillo, and plastic surgery.
We started this project in 2006, and I started as a medical coordinator, and now my current position is the regional surgical advisor for the MSF in the Middle East, covering many countries like Yemen, Syria, Iraq, Gaza, and all these issues, the surgical matters in these places. We started the project in 2006 aiming to treat Iraqis. It was the first time for MSF to go outside the home country, to treat patients outside the home country with a complex surgical interventions, reconstructions, and difficult surgeries. Throughout these years, we developed a lot of experience in this subject at all levels, at the levels of orthopedic surgeries, at the level of the plastic surgeries, and as well as maxillofacial.
This hospital, it is also, we have this specialty, like I mentioned, it's a reconstruction hospital with this three main component of ortho, maxillo, and plastic, but it's all holistic approach.
My name is Samara Ismail. I am the 3D activity manager in RSP. Here we are printing the partial hand for one of our patients. It's at its last stages. After we finalize the print, usually we go with post processes. So we paint and we post process the partial hand or the hand prosthesis, and then we start the important part in our project, which is the journey of the rehabilitation, to train the patient how to use those prostheses and to be able and to support them in their activity daily living. So this is one of our applications in the department, in addition to other applications such as plans, surgical guides, and any other assistive devices or tools that the patient use to support them in their activity daily. So here we have the different applications that we are printing in our 3D lab in RSP. This is the surgical guide that I told you about. It is printed by using biocompatible material. This material could be sterilized and after that used inside the operational theater. This is the transparent facial orthosis. As well, we are using 3D technology to make those neck or face orthoses. Previously, we were providing the patient with this pressure garment, but based on or according to the feedback of the patient, in addition to the feedback of the clinical team and the patient together, we replace it with this transparent neck orthosis or facial orthosis. It is very essential application and device used for burn patients.
حنين حسن الوديع.
أيوة العمر له 5 سنوات.
5 سنوات.
من غزة.
Depending on this scan, we do the modification and prepare to print the positive mold of the TFO. This is the first step for the TFO process. After the process, design and the printing and molding, we do the transparent facial orthosis and we cut the extra area and concentrate the pressure on the burn area. We cut over the nose and eyes and mouth to be proper fit and comfortable for the patient, and put screw with elastic to hold the TFO on the face. And this TFO after the modification, this is the final shape the TFO. Compression, the scalp condition, the skin condition, and if need more pressure, less pressure, sometimes we add silicone under the TFO. If the patient complains from compression on the edge, we do the modification and continue to follow the patient till we reach the maximum benefit of the TFO. The maximum benefit is the maturation of the scar or the skin graft. TFO in the day 20 to 22 hours, up to 1 year or 2 years, it depends on the maturation of the scar. When we reach, in this case, the maturation of the scar, there is no contraction, no redness, and there is flexibility on the scar and the skin graft, we reach the benefit of the TFO.